Hi, this is Dr. Ejaz Pasha here. Hope you're watching all our informative videos on different aspects of dentistry, whether it is preventive or therapeutic. Today, a very simple one, which is very common and very much essential for all those, is brushing techniques. Most of us, we do brush only in the morning. No wonder whether you do morning or afternoon, it doesn't matter. What matters, brushing technique, is in the night. And why it matters? Because as we all know, the tooth we have is not plain. It doesn't have a plain surface like this, but we have something like this, where there's an anatomic ups and downs. We call it as pits and fissures and cusp and so on. That is the technical terms. For a layman, you should understand that none of us, our teeth will be flat. If we have a flat, you can't grind it. So that is where you should have something like this. It's called intercuspation, right? Now, to maintain that, when you have some food, the food gets accumulated here in the spaces here or in the depressions right in the between or in between the teeth, either on the biting surface or in between the teeth. Now, how do you clean? So there are different techniques. A very simple technique is keep your brush towards the gums and go away from the gums. Something like this. Never go towards the gums. So if I close your mouth, so it should be from top, it should be like this, and going down, and then from down going up only to the biting surface. Don't take it from down to the up, or the vice versa, like doing it like this and then like this. No, you have to turn your hand with your just fingers. You don't have to use your whole elbow on the shoulder. You just use your fingers. Keep your brush bristles here and then just move like this, or in the front you can see here, and then go. So don't do this way straight. They say, most of them, we ask the patient, how are you doing? They say we are doing this. No, you have to take it away from the gums. Why? That also I'm going to tell you. Now, same way, the lower, whether it is inside also, keep it here and it should be away, not towards the gums. Okay? Now, similarly in the upper also. Now, coming to biting surface, you can do this like a normal. And now, first priority, your brush should be, irrespective of the company, should be bristles of this brush should be soft. And this brush, you should keep it at least for 2 months. That means if your brush bristles are bent even slightly, whether it is 1 week or 2 weeks, you're supposed to throw. Why? Because that's going to hurt your gums here, and that will start leading to something called as recession, sensitivity, periodontal problems, infection, and so on. So there is no end to it. It might take few months, few years, but you should not neglect that once your bristles are bent, please throw this brush. So what is the minimum duration? It's about 2 months. That means if you're holding the brush for about 2 months approximately and your bristles are not bent, that means your brushing technique or the force, whatever you're applying, both are equal and they are fine to do, or they are not harming on your teeth. Now coming to this gums, what happens after your brushing? One needs to do a tongue cleaning. So you have a rough surface like this on the brush. So you can buy something that brushes which has got rough, or you can use your soft tongue cleaners. Don't use metal tongue cleaners. Or if you're comfortable with your finger, you can use it. But you should not have nails which will scrub or bleed your tongue. So better is brush which has got the serrations like this at the back, something like this. So you find those kind of brushes in different companies. So clean the tongue with those things. The third, after brushing, tongue cleaning, and the third important is massaging the gums. Now why do we massage the gums is important. See, by nature, the gums are not attached like this. They have a gap like this, about 2 to 3 millimeter. Now this gap has got a fluid and that takes care of the infection or anything. But after brushing, the gums, they open up like this. So you need to put them back. How do you put it? You just have to use your finger and massage it with your finger inside and outside. Just two times or 3 times, just massage like this. So now this completes your actual brushing or intraoral care. It is not just simple brushing and spitting out for 2 minutes or 10 minutes. So the whole procedure can take hardly 2 to 3 minutes, including your tongue cleaning, your brushing, as well as your gum massage. Now this is about your simple brushing technique. Thank you.